There are many who've had to take prednisone for years, and they think there's nothing they can do to get off. Well, I'm here to share the story of Ron, who was able to get off prednisone after over 22 years, stuck on it for a condition called rheumatoid arthritis. Welcome to the Dr. Megan with Prednisone Warriors show. Hi, Ron.
Thank you, Dr. Megan. Thank you for having me. It's a pleasure.
Wonderful. So, Ron, tell us your story. When did you start the prednisone? Why did you take it? What was the highest dose, lowest dose? Tell us more.
Okay. All right. So I was diagnosed with rheumatoid arthritis back in high school. That was almost 30 years ago. And I was in such a bad shape that pretty much from day one, they put me on prednisone. At the peak, I got to 50 milligrams. Lowest I've been to was 5 milligrams. Of course, it's a lifesaver as a supplemental medication. But as we all know, it has horrendous side effects, especially when taken long term. And I was on prednisone for 23 years straight.
That is such a long time. I was on it for 9 months and I thought I was going to die. So I can't even imagine over 20 something years. I mean, did you just get used to it? I mean, it was just kind of how life was. How did you deal with the side effects?
For me, it was like a part of life. I thought I'm gonna, they're gonna bury me with a little box of prednisone nearby. I mean, seriously, it was a way of life.
It's the way of life. I mean,
yeah. At the end, I managed to kind of stable my dosage on 5 milligrams pretty much for the last 10 years. I think I was on it, but yeah, it really did some damage to my body. For instance, bone density. It really affects it.
Yeah. How would you know about your bone density? What is done?
Well, to begin with, the doctors put me on additional medications to kind of prevent calcium loss. And then I was on routine tests for bone density, and you could see the deterioration, especially in the hips. Yeah.
In the hips, you can see it, like you've seen the actual tests. Yeah, a lot of people don't realize the kind of damage that can happen. So I'm glad you pointed that out. Okay, so you were on it and you thought it was a life sentence and you're going to die with it. The way you said that was amazing. So then how did you even know that there was any other way to get off of it? Like, how did you discover any way to get off of it?
Well, I tried for years. Many ways, nothing worked. Every time it ended up back in pain. Even going down like 1 milligram was like, like a battle. It always came back to the 5. But then something like 4 years ago, I started hearing everyone talking about CBD. It was just everywhere, to the extent that I thought to myself, okay, I'll just, start reading about it and learning about it and see maybe there's something real in CBD fighting inflammation. So I did. I started researching CBD and discovered it's not only CBD. CBD is only one molecule in the plant. There's CBG, CBN, a lot of other cannabinoids, and additional naturally occurring compounds in the plant. And when they all work together with the right formula, then they have very strong anti-inflammatory qualities.
So this is I want to pause you before you go any further. What is CBD? Because people might not know. First of all, C as in cat, B as in boy, D as in dog. CBD. Right. What does that stand for? And what is it?
So CBD is a cannabinoid, one of many that occur in the cannabis plant. Everybody hears cannabis, they think about getting high. But on the contrary, CBD, and I mean, the only molecule that will get you high is THC. And that's why it's illegal or regulated. But CBD itself and all the other cannabinoids will not get you high no matter, what you try to do with them.
Okay.
So it will not affect anything in your daily life.
And so you were telling us it had anti-inflammatory properties.
Right. So when all the cannabinoids are mixed together, or actually the plant is taken as is, the right strain, they work together. The cannabinoids work together to create something called the entourage effect, and this is actually backed up by research. And this effect actually is known to have anti-inflammatory qualities. So when put together, the whole idea with the prednisone is basically weakens the immune system to have like less severe attacks for me, like on my joints. But if you actually treat the inflammation from the source, then it actually starts reducing the need for prednisone. And this was actually my success story. So after doing my extensive research, I try to look for some reliable brand or something like that, but the market is just not regulated. There's many people selling everything, and they will make all sorts of claims. So for me, kind of as a curious individual, I actually started searching for extractors. So these are the people that actually take the plant and put it in their machines and essentially turn it into the extract, so the oil. So I found one super high quality substance from a supplier. I did my own blend. So the extract itself it will not be absorbed by itself in the body. So it has to have like a carrier oil. So for me, I did it with MCT coconut oil. And it's pretty naturally flavored. I wasn't looking for anything, fancy. And I started using it. So the way you take it is sublingual, and that's because there's a high concentration of veins below the tongue, and the tissue is really thin, so the absorption is maximal. So I took the first drop, took the second drop, and then after 2 weeks, I thought to myself, okay, I feel much better now. And I started cutting my 5 milligram pills into 2.5, so into half. And then I took it for another week. And after 3 weeks, I thought to myself, wow, I'm feeling really good. And then I cut the pills to 125. And then I thought to myself, wait, maybe I just don't need it anymore. And the rest is history. So after 3 weeks, I still have the box with the little 125 pills, the fractures of the pills. And that's it. I never looked back.
Never looked back. So you were able to go from 5 down to 2.5 and off to 0.
Completely.
And you never even used those fourth of a 5 milligram tablet pills, and you still have them.
No, I have them as a distant memory.
Wow. So how long ago was that?
So that was 4 years ago.
4 years you have been prednisone free.
Bro,
I just think of all of the potential bone loss you no longer have, all of the potential cardiac, like heart complications you're no longer running risk for. And you're saying, are you still using the CBD every day to keep the inflammation at bay? Is that what you're doing?
I am. And yeah, the interesting thing is, here and there, I'm a little bit lazy and I miss a dosage and like nothing happens because it actually accumulates in the body long term. So one time here, one time there, it doesn't really affect. In fact, some people will, start like dosing off a little bit, like, cut the amount of the oil. You can try also doing it. I didn't really because I have no interest. But I take it twice a day, 1 milligram in the morning, 1 at nighttime. Hold it for 2 minutes beneath my tongue, swallow the rest, and that's it.
And so how much is it that you're like, is it a squeezer or how does it come out?
No, it's like it's a dropper and it has a gauge. It's gauged and you can actually, fill it up to one milliliter and that's it.
And so it's just a tiny bit of liquid that you're putting under your tongue and you just hold it there for 2 minutes. Yeah. That's pretty cool.
Easy peasy.
Yeah. I've heard of CBD gummies that people have. And what do you think?
So there's a lot of forms you can take CBD, but you have to remember that once there's something called the first pass, which is basically when you ingest something, you lose from the effectivity of the substance, and you don't really know how much is actually absorbed into your bloodstream, right?
Yeah.
So for me, this is kind of the purest version I can, purest and most effective version I can consume CBD, or, actually it's not only CBD, it's called full spectrum, which is the entire array of cannabinoids in the plant. And specifically, I consume something that's called broad spectrum, which is even without the THC. So there's no way in the world I can get high from that.
Okay. So it's all the other cannabinoids, but the THC. And
Exactly.
so they can all work together with their anti-inflammatory properties, and they're going straight under your tongue into your bloodstream instead of having to go through your gut and having your liver chop off parts of the good stuff.
Exactly. Right.
Before you can even have the effect. So that's great. Yeah. Cause I've heard of CBD gummies and I'm like, I don't know if that's the best option, especially for people on prednisone. Gummy anything is probably not a great idea because it's basically like medicine wrapped in sugar, and sugar is
that's true. I mean,
also not good.
Yeah.
So, okay, good. So you've already answered one of my main questions. What was CBD? So I'm thinking if I were a prednisone patient who's like, what can we use CBD for? There's several like situations I can think of when somebody might want CBD as an option. And so first of all, we need to know, is it even safe for people who have autoimmune conditions? Like, is it going to make their conditions worse?
No, not at all. So you have to remember that people have been using cannabis for hundreds of years. It's nothing new. And people have been using CBD for years and years. It was just not documented, not recorded, because it was illegal up to 2018, where the Farm Bill was signed, but still it cannot be really researched. But there's a lot of evidence, like thousands and thousands of people that are using it with autoimmune conditions on various medications. There has never been a recorded side effect. I heard like one time someone got a rash that they thought it's from that, and they just stopped and nothing happened. Okay. So all the evidence show that it's completely safe.
Yeah, and that's the hard part is before that Farm Bill, any part of the marijuana THC cannabinoid family of compounds were what was called Schedule I controlled substances, which means not only are they illegal to possess, but even like academic medical centers couldn't use it to do studies without going through an insanely complicated approval process. Right. And so it's not that nobody's trying to do the research. It's that it's really hard to get permission to do the research, right? Like the legal hurdles are so complicated, which is why I find it fascinating that your family is from Israel, and in Israel, it doesn't have those legal hurdles. And so I found that there's actually great studies coming out of Israel. Have you?
That's true. Yeah, actually, as far as I know, the person that discovered the CBD is an Israeli professor. The research is really, really advanced there. There's a lot of companies, popping around that. It's still illegal in Israel. So, and up to recently, they could not even export. So it was only research, no plants or nothing. But now it's changed. But it's still illegal. So yeah, the shoemaker walks barefoot.
So it's actually illegal basically in Israel, but
it's legal to research. Yeah, but not to consume.
Interesting.
So, but that's going to change probably.
It's such a tricky situation because it's so like the Farm Bill shows we're not going to enforce the legal status of these compounds that where technically the federal government could come in and say, oh, this is illegal and shut down everything that has to do with it. But they said we're not going to enforce that. And so it's just so tricky and gray, and it's a hard situation. So with that said, there are some studies, there is some evidence. And so I'm going to shoot some situations to you and see what you think. Like if you know of other people who've had that similar situation, if you have stories you can share, and just realizing that there just isn't a great evidence base for this situation. We're on the cutting edge. This is just the beginning, the baby phase of this molecule, these molecules. So the first situation is you were on prednisone and you started CBD. Are they safe together in combination?
Again, well, I'm believing evidence it's safe, but also what I didn't mention yet is that this kind of, personal success was a real wow moment for me, but then I actually saw like an opportunity to help other people. And actually this inspired me to, to found my own brand of CBD, which is actually the same formula that I was taking, or I'm taking, and I name it Reclaim. Because that's like what I felt, because I reclaimed back my freedom from, from prednisone. It's like, it was really felt like jail. So I founded Reclaim Labs, and now I have like a lot of customers with actual conditions and situations that have found help with the oil. So if you wanted to go with specific conditions, I have psoriatic arthritis, a lot of success with that, fibromyalgia as well, Crohn's, colitis. So basically anything autoimmune. Again, it will not 100% work for everyone, but you have to remember that also medications don't work for everyone, right? It's a lot of like trial and error. The way you take it, some people find that if they go to higher dosage, it worsens their condition, or it doesn't feel as well, so they just stay at a lower dosage. So let's say 0.5 milliliter morning and night. But I'm collecting all this data, which helps me actually know condition versus solution. So that's like a big thing now. In general, in the market, there's a lot of companies that are trying to collect all this evidence from the streets and compile this into kind of a dictionary of condition and solution.
Wonderful. Thank you. So that's a lot of autoimmune conditions, people who probably have to take prednisone normally. And so that's helpful to know. I did see one thing about how prednisone is broken down with the same liver enzyme as CBD, which is cytochrome P453A4, which is a potential concern, but it's hard to say if it's actually a real concern. So have you heard anything about that, or it's just—
No, I
don't even know.
Actually, I have not. But again, I have a lot of customers taking it with prednisone, and with the goal of dosing off the prednisone, and nothing ever happened.
Yeah, I mean, there's a whole company in Israel called Stero, Stero, and their whole point is CBD can help counteract prednisone. So I'm guessing if they're forming this whole company, that there must be some ability to take them in conjunction together. There's just this theoretical, hey, they're broken down by the same machine. And so if one is blocking the other, the problem, who knows? So that's one of those places with emerging research we just don't know right now. And then,
but again, if you don't consume it as an edible, then you're not facing this problem, right?
Well, I mean, eventually it has to be broken down by your liver, right? Eventually it goes through your bloodstream, and eventually it has to be broken down by your liver. But the first pass isn't happening because you're not. It's mostly being absorbed by under your tongue by your blood. So yeah, theoretically, an oil would be a lot safer alternative than a gummy because of that.
Right.
While on prednisone. I mean, if you're, I know these are like super complicated topics for all of you out there, don't worry. But basically, as I'm talking through this with Ron, I'm thinking that if you're going to take CBD with prednisone, it makes a lot more sense to be doing a sublingual oil than a chewable, because you don't want it going through your gut. So there we go. Okay, so we talked about the potential safety about it. So there are several times during the prednisone journey when somebody might want prednisone. There's when you're on high doses and you're suffering side effects. Could CBD potentially help that? So before you answer, I'm going to just draw the picture of this journey. So there's high doses, then there's lower doses and you're tapering down, and then there's after you've stopped and your condition is maybe in remission and you want to prevent inflammation. So those are the three situations. So high doses, tapering down to prevent withdrawals and to help you taper, and then post taking prednisone. So let's start with the high doses. What do you think? Have you heard any experiences of people talking about how CBD may help with the side effects?
So to be honest, no, not really. I mean, the goal where, usually people take the CBD, I mean, they come to me to try and taper down. So we don't really talk about, side effects. If I'm looking at myself, even that, so my main side effect was, bone loss. I have no way to say if it, what happened inside, inside there. So like many of the side effects of prednisone are kind of internal, right? And you don't really know, specifically what's the process there, what's happening.
Right. Yeah. So that's one of those we don't know yet.
But I guess there are researches that show that CBD can lower blood pressure.
Okay. Yeah. And prednisone raises blood pressure.
Yes.
So
Yes. So personally, I never measured it on that ground because I didn't have this problem. But yeah, it might also, help prevent that.
Yeah. So blood pressure. Another thing people are super concerned about is their mood changes. So like anxiety or depression or just the up and down of being on the prednisone, it can really be a seriously emotional roller coaster. Is there any evidence or any experiences of people taking CBD for their emotions?
So the answer is yes. Personally, I cannot attest, to that. But I do have customers that reported that they feel much less anxious and much more calm. Right. But the thing is, like, everybody that sells CBD these days will make these claims, it will reduce anxiety, help you sleep, make you more calm. So I don't make these claims. I say, I stick to my own story. But yes, I did have reports of people that felt, more relaxed, less anxious. And that actually happened faster than any other effect or side effect of the CBD.
So that potentially might be one of the faster acting ways CBD helps people.
Right.
And another thing was people have a lot of trouble sleeping while on prednisone, especially at high doses. So you're saying that it could potentially help people feel
again, potentially, yes. There have been reports of, especially CBG helping with, insomnia or falling asleep. But the main thing is, and that's like one of my challenges is actually to educate people that you really need patience and, perseverance, because people will take something and I guess prednisone, yeah, when you take it, it almost immediately, poof, you're like a Superman, especially when you get the, super high doses shots, right? Then like the next day you're like, oh, you feel like you can fly.
Yeah.
So people think, yeah, we're going to take CBD and, tomorrow I'll be better. So I did have like customers reporting, writing to me like 2 days after, it's like, wow, you can't believe it. And I'm always like, okay, relax. It takes time. Maybe, maybe it's like, it's here, but that's also fine as long as, as long as it works. But it takes a few weeks. It can take like a month, 2 months. You just need to be patient and continue the regime of twice a day, build up the substance in your body.
Yeah, exactly. That's so true with so many things. And you're right, prednisone is really the exception. It works so quickly to just kill that.
I mean, medications for a rheumatoid arthritis, like the core medications, they will take at least like, I know like methotrexate, which is, super popular, will take as much as 3 months to start seeing something.
Right. The alternatives to
So
prednisone for rheumatoid arthritis are literally 6 weeks minimum,
yeah,
right? Like,
yeah. And I always say like, so it's not that, so usually for autoimmune conditions, you do get like like the core medication, and the prednisone is helping to deal with the side effects of the condition, which is like, what you're experiencing. For me, it was pain, but also like, Crohn's colitis, it's a little bit different. But I always say, like, people ask me, so can I stop the medication? So the answer is no, like, never do it. Always, like, if you want to try playing around with your medications, like, come to a point where you feel perfect, and then you can start, like, dosing down with the
yeah,
medications. If you start playing with this, like, black or white, like yes or no medication, then you're going to worsen your condition before it's going to get better.
I like that. That's really good advice, because it's the same with the prednisone and every other controller medication. You can't just go cold turkey off of them. You need to work closely with your doctor to get you on the right medication, and slowly, with their permission, get lower on doses. Checking labs, getting a colonoscopy, whatever it is, making sure that you're really working closely with your doctor to ever stop a medication. You don't just do it on your own. Okay, so that was kind of one of my questions, is can CBD replace prednisone? Like, I guess this is like the post, kind of skipped over the tapering. This is the post, they've stopped, like they took prednisone for a flare. And now they're not currently taking prednisone. They're off of it. Next time they have a flare, can they take CBD?
I mean, the whole idea is for the CBD to, if ideally to prevent the flare-ups, right? So it's like very individual, the goal is not to need anymore the prednisone.
Yeah.
If somehow you need, the prednisone, then I guess, yeah, like take less than you used to take it for one day, not for like, a whole week, or I don't know, seriously, like, talk to your doctor.
Yeah.
I cannot give any recommendations, but just remember, it's like there's no one size fits all. It's like everybody really has to be attentive to their, their bodies and what they feel, and work with that.
I like that. Yeah. That it doesn't really replace prednisone. The idea is to prevent the need for the prednisone. Right?
Exactly. So, again, I'm a living evidence that it can prevent the need for prednisone, right?
Yeah.
Like CBD.
So you're not exchanging one for the other. You're using one to make it so you won't need the other.
Yeah, because if you think about it, the CBD is meant to prevent inflammation, right? The prednisone is meant to kind of, lower inflammation, right? By weakening the immune system. So it's completely like two different, methods of thinking about it.
So what I'm hearing is that the CBD is kind of more like one of those controller medications. It's more along the lines of the strategy of taking methotrexate for rheumatoid arthritis,
exactly,
or a steroid inhaler to prevent asthma. It's to prevent the need to have the rescue inhaler. It's to prevent the need to have the prednisone pills, because you're taking your inflammation and just turning the baseline down. Is that kind of what you're saying?
Yeah, it's actually supportive to the immune system, not like wanting to shut it off, like as the president, prednisone does.
Yeah, I like that. Okay, that's a nice way to think about it, so that it's.
And then it's speaking about like the core meds. So for my arthritis, I take what's called like a biological medication, which is an infusion of antibodies once every 6 months. And the interesting thing is that since I've been on the oil, I've been starting to spread out those infusions to the extent of over a year. So I actually don't feel, before that, like when I was with prednisone, when the 6 months mark came, I started to feel my joints a little bit. I call it like feel myself. It's no longer happening. And I actually asked my rheumatologist at the beginning when I started taking CBD, can I completely get off the biological? So he said, no, I don't recommend doing it. It's not a, well, they call it like disease modifying medications. It's not, it's just like a supportive medication. And now that I talked to him, I said, like, listen, can I do like once a year, once a year and a half? And he said, well, yeah, if you feel like it, so don't do like every 6 months. And it's fine, you know. So
Yeah.
it does do something, you know, internally, systemic.
Yeah. So before you started using CBD, you had to take the infusion and prednisone and anything else, or was it just the two?
No, I've taken so many, like across like 30 years.
Yeah.
I've
You've
taken
tried
so many
everything.
medications, everything. And mind you, like in the past 20 years, the biologics went into the market. And that was like a real breakthrough in treating autoimmune conditions. Like I
Yeah.
really have nothing else to say. And people like it has like the stigma where people are afraid of the biologicals because they say, you know, it puts you in risk for other.
So we've decided that CBD doesn't replace prednisone. It prevents the need for prednisone, because I know people have asked, like, how would I incorporate the CBD with my prednisone? Like, do I, if my prednisone is here, do I slowly go down here while I'm increasing the CBD? How would you do that? Like, if somebody's slowly trying to taper off of the prednisone, how do you, like, what's the best strategy to incorporate CBD with prednisone? And this is all your opinion. There's no evidence here yet, right?
Right. Only me and some customers. I mean, the way I did it is, and again, I always say, like, you know, come to a point where you're stable, you feel good, and then start going, you know, to our context, like the prednisone. So I started building up, you know, and for me, it was pretty quickly, like 3 weeks is pretty quickly, but I started by taking the oil, and only like, I think after a week, I started cutting down the pills. And then for the next 2 weeks, I was on the 2.5, and then I didn't need it anymore. But usually, I also tell people, you know, start with half a dose of the CBD, so like half a meal in the morning, half at night, and then like after a week, go up to 1 meal morning and night. And then again, like when you feel you're stable, you feel good, then you can start, you know, playing with the dosage of the prednisone.
Okay. So you kind of slowly working your way up on the CBD, and you're
Right.
slowly working your way down on the prednisone.
Mm-hmm.
So it is kind of like you're going to meet in the middle and cross over at some point.
And I just because I've been in this, you know, I've had these conditions for so many years, I'm kind of very experimental, autodidact. I basically didn't tell my doctor because I knew he's going to say, you know, the doctors are, you know, not really into that because it's not clinically researched, and, you know, this whole story. So I just came to him with the facts. I guess you know, it's better to talk to your doctor, but just, you know, take into consideration that they are not, it's changing now, but they're not really recommending that. Or how did my rheumatologist said, I will not tell you to take it, but I will not tell you not to take it. So it's kind of, yes, it's kind of your choice.
Such a gray zone right now. They can't
They can't,
really
just because
recommend
the you know, regulations. They
Yeah.
cannot recommend anything that was not tested, you know, phase 1, phase 2, phase 3, you know, FDA. They're not allowed to.
Right.
So, you know.
Exactly. And so while they might be sympathetic, they might even use it themselves. Who knows? They can't really say, okay, stop your biologics, stop your methotrexate, stop everything and just do CBD. They're not going to say that because that's not within their scope of practice, really. It's not, they just aren't going to do that. So this is really helpful to see how it could be done. There's no regulations, there's no guidelines, there's no like clear evidence today, though that company in Israel is working on it, which is like super awesome. But
I'll try and talk to them. Maybe we can interview them.
Yes. Oh, that would be so cool if we could interview Stero. That would be awesome. Because I mean, it's coming. That's what I'm excited about, is we're just on the cusp of it. And having a high quality supplier and a high quality product is really important if you're going to do this, because
Right.
there are some sketchy companies out there.
Right.
And so, and then back to your conversation with your doctor, I know that after 20 something years on prednisone, a lot of patients are given the go ahead by their doctor to up their doses and down their doses because they've worked so long together. They've worked,
Right.
and this person's familiar with how the prednisone works in their body. And it's really between you and your doctor, whether that's going to be how it is for you. So some people, that's a thing. Some people, like my doctor, I'm a pharmacist, and she didn't let me dose, like do my own taper.
Well, that's because doctors and pharmacies, they have the thing, like it's like, head to head.
Yeah. So I mean, it's really independent. Like every doctor is different. Your relationship with your doctor, your disease, how under control it is. All of those factors are important to consider. And so none of this is black and white. It's all very gray. All needs like a lot of testing and trial and seeing how it feels with your body.
The only recommendation is to be conscious of your body, like, like feel it, and also like buy high quality. Most chances that if you go to your bodega in the corner and pick up some CBD, it's not like the best. I always provide people, if they ask for a lab analysis, so they can actually see it's completely clean, no like heavy metals, no pesticides. They can see the exact composition of the plant. So always ask for it's called like a COA, certificate of analysis. I mean, if someone cannot give you that, that's like a red light.
Huge red flag.
Yeah, red flag, or like, yeah.
Those are great tips for finding a great product. And then, I mean, since we know you have a great product, where can they find it?
So my website is called reclaimlabs.com. Actually, what I do is, because again, people are impatient, I usually like the first purchase, I would throw in another bottle on me for free, just to give people like more runway and to actually have a real chance to try it and let it succeed. Because most chances that one bottle is not enough. And I kind of have to hold their hands. It's like, wait, don't give up. And then usually they come back. Yeah. So again, it's like education.
Very good. Very good. I love that. Thanks for throwing that in. That's super generous. So Ron, I appreciate you joining me today, teaching us what we currently know about CBD. And I'd love to have you back someday when we know more and we can share more details and more evidence and find out what this amazing plant from nature can share with us, because prednisone is based on nature, our cortisol,
yeah, that's true.
And then CBD is from a plant. And so these can potentially have a great future together. Let's find out more. So thanks, Ron. Appreciate
Thank you so much. My pleasure. Hope to see you soon. All right. Take care.
Thank you so much. This is Dr. Megan, your prednisone pharmacist.